Our fourth topic is on burns, and we want to look at the first aid burns. Do you know what burns are? I do assume that you know. Maybe in our class, you share with me what you think burns are. But just basic understanding is that they can come from different sources. It can be fire itself, it can be hot water or hot liquids. Yeah, it can be a burn from chemicals. Like, we need to explore what can bring about burns and what they are. So usually minor burns and major burns. So it's a minor burn to cool the burn to help soothe the pain. So you hold the burn area under cool water, not cold, running water for about 10 to 15 minutes, or until the pain eases. Or apply a clean towel damp with a cool tap water. Then you remove rings or other tight items from the burn area. Try to do this quickly and gently before the area swells. Then you also need not to break the blisters, the small blisters. So it's not bigger than your little fingernail. Leave them alone. If blisters break, gently clean the area with mild soap and water. Apply an antibiotic ointment and cover it with non-stick gauze bandage. Apply moisturizer or aloe vera lotion or gel, which may provide relief in some cases. If needed, take an over-the-counter pain reliever such as naproxen, sodium, and norphen. In Kenya, mostly we just have brufen or ibuprofen that has, some of them have a combination of paracetamol and brufen. Yeah, sometimes an antibiotic could be administered. Also consider tetanus shots. Make sure that the tetanus booster is up to date. The doctors would recommend people not to get a tetanus shot at least every 10 years. Choose your doctor. Develop large impact on their own. So also to help if the burn covers a large area of the body, or if noticing infection such as oozing from the wound and increased pain, weakness, and also swelling. For the major burns, you need to call for an emergency medical help until an emergency unit arrives. But before then, you need to take action to protect the burn person from further harm. So if you can do so safely, make sure that the helping is not in contact with smoldering materials or exposed to smoke or heat. Don't remove burnt clothes stuck to the skin. So check for signs of circulation. Look for the breathing, coughing, or movement. Begin the CPR if needed. Remove jewelry, belts, and other restrictive items, especially from around burn areas and the neck. Then burn areas do swell rapidly. Don't immerse a large, severe burn in cold water. Cause a serious loss of body heat, that is hypothermia, or a drop in blood pressure and decreased blood flow, that is shock, which could now even be detrimental to the person. And so elevate the burned area, raise the wound above the heart level if possible, then cover the area of the burn. Use a cool, moist bandage or a clean cloth to cover the wound. So is it a major or a minor burn? So if it's not clear what level of care is needed, try to judge the extent of tissue damage based on the following burn categories. So we usually have several degrees of burns to help tell us if it's major or minor. So the first degree burn, the least serious type, involving only the outer layer of the skin, it may cause redness, swelling, and pain. You may usually treat it with um, you treat it as a minor burn, and if it involves much of the hands, feet, face, groin, buttocks, or a major joint, seek emergency medical attention. When you do have the second degree burns, whereby it's more serious, and it may cause red, white, or spotchy feeling, swelling, spotchy skin, there's swelling, there's pain, there's also blisters. If the second degree burn is no longer than 3 inches, 7 to 6 centimeters in diameter, treat it as a minor burn. If the burn area is larger or covers the hand, hip, groin, buttocks, or major joint, this is a major burn and get medical help immediately. For the third degree burns, which is the last category of burns, you just need to do what? You just need to check on the layers of that. So most serious burns involve all the layers of the skin and underlying fat, muscle, and even bone may be affected. The burn areas may be charred, dark or white, and the person may experience difficulty breathing, carbon monoxide poisoning, or other toxic effects if smoke inhalation has also occurred. So you need to help the person move away from the area where there is danger, help the person to be able to breathe properly. You check for ABCDs that we talked about. Yeah, you ensure that the airway is open, the person is breathing, and you check for the cardiopulmonary. If the person is able to see, hear, do things by himself or herself. If there's no breathing, you need to do the CPR so that you can help the person jumpstart the system in terms of lungs in breathing. So with burns, we didn't have a lot of information on that. You can still read further and also check on the links that I'll attach here in this topic so that they can be helpful to you. And I know that it shall be okay. So we'll meet the next topic. This one was very, very brief. And remember, I've asked you that you'll need to tell me the differences between the minor and the major burns, how to manage them and what a burn is and what will bring about a burn. Remember, like the children who burnt in Moi Girls, there was a fire outbreak at night, and, they were crying all over, calling for help, and they were so frustrated, in the middle of the night, and the fire breaks out, these young children were so overwhelmed. And others actually died because of inhaling these fumes, the smoke of the mattresses, because it was a dormitory. You can imagine those children. When you're around people who suffer from burns, you are likely also to experience the trauma in case you are a witness to what happened. So even if you are a first responder and you still witness, it can be very traumatizing. You can imagine those girls were crying out, help me, I'm dying, I'm dying, I can't breathe. They were so traumatized. But eventually, there are those who died, there are those who survived, and eventually there are those who were able to get help, and right now they have recuperated. So I do hope that we can interact in our next class well. But if you have any questions around the issues on burns, just remember we have the 3 degrees of burns, superficial ones, we have which are just minor, and the second degree, which could either be minor or major depending on the organs it has affected, and also the third degree, which are majorly minor because they do affect most layers of the skin. I hope that we've understood something concerning the burns this day, and we shall interact further. So have a nice time.